Millions of Americans require access to life-saving treatments like dialysis and chemotherapy every single week. For these patients, a single missed non-emergency medical transportation ride represents a direct threat to their health. But the current reality of waiting for that ride is often agonizing. Patients wait on curbsides or benches, watching their appointment time pass with no way to know if their vehicle is even on its way. Inside the clinic, the situation is just as chaotic. Facility coordinators spend hours every week stuck in an endless loop of phone calls with dispatchers, trying to track down late vehicles while their daily schedule falls apart. This chart shows the financial toll of that uncertainty. When no-show rates hover between 15% and 30%, clinics lose roughly $200 for every unused appointment slot, stacking up into massive daily losses.
These logistical failures represent more than an inconvenience. They are a breakdown in a system that is supposed to guarantee access to care. The root cause of this breakdown is an infrastructure built on archaic, untrackable paper logs and radio dispatch. This analog honor system creates a massive loophole for systemic fraud. It allows for the creation of ghost trips, where providers bill Medicaid or insurers for rides that only exist on paper. Combined with frequent manual billing errors, this vulnerability drains finite healthcare resources and diverts funding directly away from patient care. However, a digital revolution is beginning to restructure this infrastructure, mapping and monitoring the industry's former blind spots. Replacing a paper-based honor system with precise digital tracking is the primary mechanism for closing these loopholes. The process begins when a facility coordinator initiates a trip. Instead of picking up the phone, they use a dedicated digital portal to request a ride. Behind the scenes, scheduling software instantly analyzes dozens of variables. If a patient requires a wheelchair lift, the system assigns a vehicle with that exact capacity. Simultaneously, it verifies the driver holds the required medical transport certifications. This immediate calculation stops human error before the vehicle ever leaves the garage, saving the coordinator hours of administrative work. By automating the booking stage, coordinators are free to focus on managing patient care rather than logistics. For the patient, the wait is no longer a blind gamble. Real-time GPS tracking sends an automated text message to the patient's phone, featuring a live map and an exact ETA. The facility coordinator is simultaneously monitoring this exact same tracking data on a centralized dashboard. This dual visibility allows clinics to manage patient flow dynamically. They can coordinate exactly when a patient should be ready for pickup, drastically reducing time spent idling on the curb. As the ride reaches its destination, the system enters the verification phase, the most critical part of the process. This generates breadcrumb data, a continuous, time-stamped log of GPS coordinates recorded automatically throughout the trip. This data is paired with electronic trip verification, where digital signatures seal the record of the pickup and drop-off. This combination of GPS logs and digital signatures makes it physically impossible to execute ghost trips or inflate knowledge. This digital paper trail ensures every completed ride is an indisputably verified medical event. The verification continues even after the ride ends. Because the trip was GPS tracked and digitally scheduled, the software automatically generates a clean claim for reimbursement. Automated claim scrubbing cross-references the trip data with payer rules, ensuring everything from mileage to authorization codes is matching before the claim is submitted. In this environment, NEMT software functions as an integrity engine for the broader healthcare system. By automating these checks, these platforms ensure that healthcare dollars are accurately accounted for and directed back to actual patient care. The digital transformation of NEMT replaces curbside anxiety with the dignity of a reliable, safe, and transparent ride to the care patients need.